Thank you for joining us for the webinar, Becoming a Certified Application Counselor for the upcoming ACA Open Enrollment Period, Opportunities for Social Work. My name is Anastasia Pruitt, and I'm a Program Coordinator with the Council on Social Work Education. This webinar is co-sponsored by the Centers for Medicare and Medicaid Services, the Council on Social Work Education Gero-Ed Center, the National Association of Social Workers, and the Society for Social Work Leadership in Healthcare. Our organizations recognize the contributions that the social work community can make in linking individuals to health insurance coverage. 7 million Americans gained affordable health coverage and the peace of mind that comes with it during the first Affordable Care Act open enrollment period last year. But millions more remain uninsured, leaving them vulnerable to poor health outcomes and financial insecurity due to expensive out-of-pocket medical costs. In this webinar, we'll discuss how social workers are already contributing to insurance enrollment and how interested parties can apply to become a Certified Application Counselor, or CAC. CACs are trained volunteers who help people enroll in the health insurance marketplace. Because of their skill in reaching underserved populations, social workers with CAC training are needed to make the next open enrollment period, which begins November 15, 2014, a success. Before we get started, I'd like to point out that your phone lines are muted. Please use the chat box at the bottom left portion of your screen to submit questions. At the end of the presentations, we'll have about 20 minutes for a question and answer session. You don't need to wait until the Q&A session begins to submit a question. We'll collect them throughout the webinar and address as many as time allows. Our first presentation will feature social workers who were actively involved in enrollment efforts in the first open enrollment period. In the second presentation, we'll hear from 2 CMS representatives who will discuss the process for becoming a CAC. So first, we'll hear from Nikki Viverette. Nikki is the Navigator Program Coordinator at the Tennessee Primary Care Association.
Thank you for having me. This is Nikki Viverette. I work with the Tennessee Primary Care Association, which is a statewide nonprofit with a mission to improve access to primary care. We do that through leadership, advocacy, and support in partnership with our community health centers. The core members are Tennessee's federally qualified health centers, or FQHCS, but we also have membership with primary health clinics, rural health clinics, and charitable clinics. Currently, we have 34 FQHC members with more than 206 active sites. Next. So here's some characteristics about Tennessee federally qualified health center patients, and we'll explain why these are important. Before the Affordable Care Act kicked in the major parts of the law in October of 2013, these are the statistics about our health centers. 57.6% of patients were below 100% of the federal poverty line. That's important because in states like ours that did not expand Medicaid and marketplace subsidies or premium tax credits don't kick in until 100%, people who are below that line and aren't eligible for Medicaid fall into the Medicaid gap, which is a problem in about 23, 24 states. Accessing care for that population can be especially difficult. In Tennessee, about 40.4% of our FQHC patients were uninsured. This is particularly important because accessing health coverage and the care they need is a huge need for this population. So why are these things important? Access to health coverage helps ensure healthier populations. It improves access to preventive care and provides financial protection for individual and families. More people covered also means more sustainability for hospitals, clinics, and other community resources, and ensures that they can continue to provide care to their communities and their patients. The ACA expands access to health coverage through insurance protections and through private insurance in the marketplace, as well as through Medicaid in states that expanded. However, in some states, there was a gap created by a lack of Medicaid expansion, which means many individuals and families are not able to access the care they need. Sisters are a huge part of this to ensure that people who fall into that gap can find additional ways to access care. Also, health insurance can be confusing, and with all the new changes, having people available to help and explain things makes a huge difference. Next. So we're going to talk a little bit about our Navigator program, We were funded by the Centers for Medicare and Medicare Services 2013 through 2014 to be navigators. We had 10 navigators that were federally trained and did 4 essential tasks: train, provide technical assistance and support, do outreach, and enroll Tennesseans. We did that by providing nearly 30 trainings, more than 6,500 instances of technical assistance, helped at nearly 350 events, and enrolled more than 500 people. And those numbers are up until about summer of this year. We primarily worked with the 80 Certified Application Counselors, or CACs, at Tennessee's federally qualified health centers. But we also worked with other navigators, other CACs, other volunteers, and organizations that worked with uninsured or vulnerable populations. We wanted to make sure that all our partners had the information, the training, and the support they needed to work with their patients and their communities effectively. To do that, we remained up to date on all aspects of the Affordable Care Act in the marketplace and Tennessee-specific items or programs like Medicaid and CHIP. Next slide. Why is this work important? I think this work is important for one of 3 reasons, or all of these reasons. This work is historical and engages with issues of social justice. It's an opportunity to be a part of work that extends health access to millions and millions of people in the United States, including many vulnerable populations that you may work with. Many people who previously could not access care now can. This work is crucial. Expanded health access ensures more people, including you, your neighbors, your families, your populations, your communities, are able to get the care they need. And having someone to assist while going through that process makes a huge difference. Last year there was a report that came out, or this year there was a report that came out, and Enroll America said the difference in people who didn't enroll and did enroll was having assistance in enrolling. This work is mentally demanding and incredibly rewarding. Being able to make something so big, so confusing because it's new or ever-changing, more manageable, more understandable, and personal is a gift to a lot of people. And especially with reduced enrollment and assister funding this year nationwide, there is an additional crucial need for more people to assist. Next, just a quick note on our program and how it was funded. It was funded through the Department of Health and Human Services, through their vessel of CMS, and also through BIPIC, the Bureau of Primary Health Care, and also with local funding from Baptist Healing Trust. Thank you very much.
Thank you, Nikki. So next we'll hear from Linda Mertz. Linda is the former co-principal investigator of the Navigator program at the University at Albany School of Social Welfare.
Great, thank you very much. I wanted to talk a little bit about our Navigator program that we had here at the School of Social Welfare, we still have, as an example of how social work skills can really dovetail with assisting people with their enrollment. And I think it mirrors much of what Nikki has already said. So in 2013, we received a grant from the New York State Department of Health to hire social work students to be navigators for the Affordable Care Act. So our program is much smaller than the one you just heard about. And our navigators were trained and do help consumers and small businesses look for health care coverage options through the health insurance marketplace. And as you probably know, navigators are required to be unbiased as opposed to brokers who may represent certain insurance companies. So we thought social workers and social work students were a wonderful match for this position. Next slide. So the context of the Navigator program within the School of Social Welfare, this was a really great opportunity for social work students to both gain health literacy, health insurance literacy, and financial literacy. But I'm going to expand a little bit more on some of the advantages for master's level social work students, which is on the next slide. The social work students reported to us that they got a wonderful opportunity to meet with a real spectrum of populations, very different from their field placement. They may have an opportunity to work with one population. Here they were able to see a real range. They also got an exciting firsthand opportunity to see national policy being implemented and all of the interesting twists and turns that go with that. And lastly, they were able to develop a range of skills: interviewing, marketing, and community outreach. Next slide, please. So we hope that our social work students also created advantages for clients. Our social work students already had engagement skills. They had experience working with hard-to-engage populations. They had sensitivity to work with a number of diverse groups, and they really did work with a number of diverse groups: people in jail, homeless people, refugees, people with mental illness. And social work students have the empathy and willingness to devote more time to groups who need a little bit of extra time getting through the enrollment process. Lastly, our school has partnerships through our internships and field work with many agencies that serve hard-to-reach groups, so that gave us entrees into a number of different community agencies and partnerships. Next slide. Another advantage that we really saw for clients is that social workers are able to are willing to educate clients about health insurance concepts. A recent study by Drew Altman from the Kaiser Family Foundation found that 37% of enrollees in the Affordable Care Act don't know the amount of their deductible, and that 26% weren't confident in their understanding of what a premium is. More were not sure of what coinsurance was. The study also found that people with lower incomes were even less likely to understand key elements of insurance, so clearly they have very low health insurance literacy. So it's really critical that navigators assist clients in understanding all of these concepts. Our student navigators were also able to help clients move forward in what they need to do next once they have health insurance. How do you pay the premium? How you choose a primary care physician, and go ahead and make an appointment before the crisis so that they're able to have a provider in place. Next slide. So I asked our navigators to provide us with some information about what they saw as some of their assets in working with clients. So I have a couple of stories that I'd like to share. My first story came from Kevin, who really wanted to emphasize how people can be very overwhelmed with their choices in their health care plans, usually because they're overwhelmed by the life circumstances that brought them to need to make changes or get health insurance. And he told me of a recently divorced woman who, did not have health insurance because of her recent divorce. When she called, she was crying, she was overwhelmed. Kevin was able to sit with her, listen, clarify, help her work through her options and to enroll and complete her enrollment. Another navigator, Katie, wanted to share with you that she felt her ability to remain calm and focused and informative as a social worker was really helpful to her. She gave an example of a young mother who was applying for coverage for her family. They'd lost their family coverage, and the cost of the premium for her coverage was going to be quite high. Unfortunately, there was nothing Katie could do to find a lower premium for her, but she was able to help this woman enroll her children in our Child Health Plus, so that the children were covered and she could really focus on her children, had health insurance, would have the care they needed, and that they would continue to work together to find a plan for the mom when she's able to do that. And Katie said, sent me a quote, she knows when she's ready and I'll be there to help. So they developed a relationship that would carry on into the future. My last example comes from Caroline, who works a lot with refugees. And refugees are legal immigrants who've been granted refugee status. And so she told me a lot about how she works with clients who come from all over and really see this time here in the United States as a time to start over, get their feet on the ground, build their lives up. And for many of them, receiving health care coverage, this is the first time that they've had health care coverage of any kind, certainly the first time that they've come in contact with the U.S. healthcare system. So they need a lot of education about how the process works, and our students empower them to take care of their physical health. So I wanted to present these examples to you as so you can see how social work skills are a really natural fit with enrolling people in the health insurance marketplace. Thank you.
Thank you, Linda. So next we'll hear from Pam Thompson. Pam is Director of Social Services at Kootenai Healthcare in Idaho, and she's also President of the Society for Social Leadership in Healthcare.
Thank you so much, and thanks for inviting me. I'd like to start out by talking about what we did last year in the fall of 2013. One of the things that's interesting about Idaho is we had opted to be a hybrid last year. We were state and federally based marketplace plan, and we also decided not to expand the Medicaid program. So we were not involved in the Medicaid expansion program either last year nor this year. Kootenai Health Social Services partnered with our federally qualified health clinic as well as our 5 smaller northern county hospitals. We have little primary access hospitals that are about 25 beds in the 5 northern counties of North Idaho. And so we partnered with all of those agencies, and we trained 33 certified application counselors. In addition to that, we also trained 3 Boise State master's level interns, which was a wonderful golden experience for them in learning about policy, health, the Affordable Care Act, and just the gaps in policy as well. We ended up providing community in-services on the insurance marketplace exchange at all the local libraries in North Idaho, as well as advertising in the local paper regarding assistance with applications. Because our portal was down most of the time, which was no surprise, I'm sure, to anyone, we completed hard copy applications as well as applications over the phone. And so mailed those in by snail mail, and individuals ended up getting their policies a couple weeks later. We were very pleased and impressed that Idaho enrolled 78,000 people. Last year, we were second to Vermont in terms of enrollees per capita, despite all of our hurdles. And so let me talk about what we're planning to do this year, and that would be the next slide. This year, in 2014, we are purely a state-based marketplace. It's called Your Health Idaho. We will have social workers available. I have 24 staff, 2 MSW Boise State interns that are available to assist anyone that does not have insurance. What we do is it's called Access. We have a program that we are currently developing through our clinics and our hospital as part of the National Coverage to Care campaign, where any uninsured patient will meet with us to talk about any and all programs that they are eligible for, whether that would be Medicaid CHIP, possibly a marketplace plan. We are usually the first line before they begin to meet with their primary care provider on a treatment plan. The other thing that we're doing is we purchased 5 iPads this year, which they are working superbly in completing applications in patients' rooms as well as the outpatient clinics and in classrooms. And I have got to say that has helped an awful lot. And so that's what we're doing this year.
Wonderful. Thank you so much, Pam.
You bet.
So our next speakers include Pamela Nicholson and Tricia Beckman. They're both from the Centers for Medicare and Medicaid Services. Pamela is the CAC Project Officer, and Tricia is the CAC Policy Lead.
Good afternoon. Welcome to How to Become a CAC Organization in a federally facilitated marketplace. My name is Pamela Nicholson, and I'll be sharing some information with you about the CAC program in an FFM. Please keep in mind that if there are organizations on the line today that are interested in the CAC program that are located in a state-based marketplace, please contact that state-based marketplace or the Department of Insurance in that state for additional information about the CAC program. Next slide. So listed on this slide are the agenda topics that we'll be covering today. We'll be covering what a CAC organization is and an individual CAC, so we'll make that distinction. Becoming a designated CAC organization in an FFM, the agreements that need to be in place, Find Local Help, what information is housed on Find Local Help and what Find Local Help is, individual CAC training and the certifications that are needed, the consumer authorization, and then we'll wrap up with tips. Next slide. So what is a CAC organization and an individual CAC? Let's start with the organization. So in addition to the information outlined on the slide, a designated organization is an organization that has expressed interest in the CAC program and has completed an online application. Once that application is approved and the organization submits an agreement to CMS, CMS then issues counter-signatures in a signed agreement as well, and that organization becomes designated. An individual CAC is an individual staff or volunteer of that organization. So in essence, CMS designates the organization, and the organization in turn manages and certifies its CAC staff. So how to become a designated organization? Pretty much the steps that I just covered. So an organization who's interested in a CAC program would submit an online application, and once that application is approved, they'll receive a welcome packet of information, and I'll cover that information in a later slide. The organization will then return the signed agreement, and CMS will return notification of confirmation of designation. So what does it mean to be a CAC or CAC organization? There are many benefits to being a CAC organization. Namely, the organization, once designated by CMS, can hold themselves out to being a CMS-designated CAC organization. CACs get weekly updates via the weekly newsletter and a sister call. And organizations are listed on Find Local Help, and I'll cover Find Local Help in a later slide. CACs receive web-based training from CMS, so that's another important benefit to being a CAC. Next slide. So becoming a CAC designated organization. Let's go over the application. There are 5 parts to the CAC online application. There's basic information about your organization. There's the marketplace contact. So who at your organization should CMS contact if needed? There's general public contact information, and this public contact information will be displayed on Find Local Help. So this information will include your organization's address, city, state, zip code, languages spoken, and also the hours of operation. And your organization's hours of operation may differ from the hours that you will assist consumers. So for instance, if your organization is open from 8 to 5, but you only provide CAC services from 12 to 5, then you should list the hours that you will be providing CAC services. There's also a part on the application about your organization's details. So if you're a healthcare delivery org or if you're 501c3, you should indicate that on the application. There are a couple other options about organizational details too, but that's just an example. There's also a field or fields for privacy and security experience. So does your organization, how does your organization handle PII? Does your organization have processes and procedures in place to screen staff and volunteers? And is your organization in a position to help consumers with health coverage decisions? Also on the application are multiple locations. Right now, the current application can hold up to 5 locations. So these would be the locations that your organization provides CAC services. If your organization would like to provide CAC services at more than 5 locations, you can send that information into the CAC questions mailbox, and that mailbox is CAC questions, all one word, at cms.hhs.gov. Again, keep in mind that CMS does not designate or certify individuals to be CACs in the SBM states and does not designate or certify organizations to be CAC organizations in SBM. Next slide. So the eligibility requirements needed for a CAC organization in an FFM. So outlined on this slide are the criteria that an applicant must meet. You must be located in an FFM state and provide CAC services in an FFM state, have processes in place to screen your staff and volunteers, have experience in social services and providing social services to the community, be in a position to help those you serve with health coverage decisions, and also certify only as many individual CACs as you can reasonably oversee. An organization must also have or at least manage and certify at least one individual CAC. So once your application is approved and you're designated, you must manage and certify at least one CAC within your organization. Next slide. So the types of organizations that likely meet eligibility requirements, in addition to meeting specific criteria, there are many organizations, including faith-based organizations, that are eligible to be CACs. A few examples include hospitals, health systems, Ryan White HIV/AIDS providers, and others are listed on the slide. If you have questions about your organization's eligibility, you can send questions to that CAC questions mailbox. So the factors that would make an organization eligible to be a CAC are the opposite that would make it ineligible. So if your organization is not located in an FFM state, if you don't have processes and procedures in place to screen your staff and volunteers, if you don't have prior social service experience, and if you're not in a position to help consumers with health coverage decisions, then unfortunately you would not be eligible to be a CAC organization. But please keep in mind that if you have questions about your organization's eligibility, you can send questions to the CAC questions mailbox. Next slide. So how does your organization handle PII, and does your organization safeguard PII? So it's important that your organization have adequate safeguards in place to protect PII. The organization's basic measures for protecting the privacy and security of PII should include one or more of the following as outlined on the slide. In addition to the basic measures for protecting the privacy and security of consumers, there must be personnel that oversee the privacy and security of data for that organization, and there should also be processes to notify the appropriate staff at the organization in case PII or PHI, personal health information, is wrongly disclosed. In addition, CMS recommends that each organization review the standards set forth in the agreement and then evaluate and document its current policies and procedures for protecting the privacy and security of data and any PII it might handle or have access to, so it can refine their policies and procedures as needed to comply with the requirements as set forth in the organization's agreement with CMS. And I'll go over the agreement in a later slide. In addition to the basic measures for protecting the privacy and security, there must be personnel that oversee the privacy and security of data for the organization, and there should also be a process to notify the appropriate staff at the organization in case PII or PHI is wrongly disclosed, PHI being personal health information for the consumer. In addition, CMS recommends that each organization review the standards set forth in the agreement, and I'll go over the agreement in a later slide, and then evaluate and document its current policies and procedures for protecting the privacy and security of data and any PII it might handle or have access to, so it can refine their policies and procedures as needed to comply with the requirements as set forth in the organization's agreement with CMS. And again, I'll go over the agreement in another slide. Two different types of agreements must be in place. So there's the agreement between CMS and the CAC designated organization. In order to become designated, your organization must sign the agreement. The agreement cannot be modified. And once we have received that signed agreement, CMS will send back counter signatures as well as notification that your organization has been designated. Once designated, your organization's information will be on Find Local Help, and I'll go over Find Local Help in a later slide. There's also the agreement between the organization and their staff and volunteers. An individual CAC must enter into a written agreement with the organization to bind the individual CAC to CMS's standards for the CAC program. This is a requirement. One of the pieces of information that we include in the welcome packet is a model agreement that you can use with your staff and volunteers. So those are the agreements that need to be in place. Next slide. Find Local Help. So Find Local Help is a publicly accessible online tool that lists the service locations for sisters, including CACs, in federally facilitated marketplace. Keep in mind that the information on Find Local Help is for sisters that are located in federally facilitated marketplaces. So all the service locations that you list on your application and all of the service locations that you submit to the CAC questions mailbox, I'm not sure if I covered that, but if you have more than 5 locations, you can submit those locations to the CAC questions mailbox, and we'll make sure that those locations are displayed on Find Local Help. If you need to make updates to Find Local Help, there is a Request Corrections link on Find Local Help, and that Request Corrections link is to make corrections to information already displayed on Find Local Help. If you want to remove a location or if you'd like to add a location, send those inquiries into the CAC questions mailbox, and we'll make sure that information is listed on Find Local Help. Next slide. So individual CAC training. CMS does provide training to CACs, and the primary goal of the training is to prepare individual CACs to assist consumers with learning about the basics of health coverage. There are other resources that we also have for CACs once certified. So in addition to the training, there are other resources as well, and I'll cover those in a later slide. So training for individual CACs is available. Your organization will assign their staff and volunteers with a CAC ID. That CAC ID becomes the login ID on the training, just so we can have a record of which CACs, which of your staff and volunteers have successfully completed the training. Once the training has been successfully completed, the system will issue a completion certificate. That completion certificate is part of the certification that you will provide to your staff and volunteers. So let me clarify. So the training is just a portion of the certification that an individual CAC needs. So in addition to the training, CACs must also sign the agreement, meet any other requirements as set forth by your organization, and meet state requirements such as exams, licensing, background checks, and things of that nature. Next slide. Listed on this slide, there are 7 modules that must be successfully completed, and again, they're listed on the slide. The training courses are designed to be taken in a specific order, so you must complete one module before moving on to another. CACs must complete all required courses and successfully pass all course exams with a score of at least 80%. The required training can be taken in approximately 5 to 10 hours, but that varies from individual to individual. The training is web-based and self-directed, and CACs can take the training at their own pace and can access the training material at any time of the day. And again, the training can be completed all at once in one fell swoop or taken a few hours a day. Next slide. So consumer authorization in an FFM. What is the consumer authorization requirement and record keeping in the FFM? An individual's authorization must be obtained prior to gaining access to any individual consumer's PII information. To help CACs meet this requirement, CMS has developed a model consumer authorization form, and the model form provides that the consumer is giving consent for the disclosure of his or her PII for the purpose of allowing the CAC to perform specific duties in assisting the consumer. Therefore, unless the consumer directs otherwise, a consumer's authorization is valid for the period of time for which the consumer requests assistance from the same CAC to provide services. However, if the consumer seeks application assistance from a different CAC at the same organization who did not obtain the consumer's authorization, or from a different CAC organization, even if it's for the same application or enrollment process, the new CAC or new CAC organization must obtain a separate authorization from the consumer before providing services. And CMS does recognize that this may be a little burdensome for the CAC organization, so we're looking into streamlining consumer authorization and make it a little more easier for the organizations. I'd like to also share that consumers may give their authorization themselves, such as by signing an authorization form, or choose to have a legal or authorized representative provide authorization on their behalf. CACs may obtain a consumer's authorization verbally, in writing, or both. And a record of each authorization must be retained by the CAC designated organization, either electronically or in hard copy format for at least 6 years. Next slide. So this slide has information about CAC recertification. As new CAC organizations, this will not impact you in any way because as a new organization, you will not be recertifying. So I'll just highlight some of the things about recertification. So recertification is for existing staff and volunteers. To recertify, organizations must pretty much do the same thing that they did to certify staff. So their staff and volunteers must successfully complete the training. They must sign the agreement, meet any state requirements, and meet any additional requirements as set forth by the organization. There's also a recertification request form just to make sure that there are no conflicts of interest for the CAC, individual CAC. So again, this won't be needed for a new organization, but I just wanted to highlight some things. Next slide. So on this slide are tips that we'd like to share. So one being, make sure that your staff take the required CAC training before assisting consumers. Make sure that your staff and volunteers are certified before assisting consumers. Keep in mind that successful completion of the training is not the final certification. Individual CACs must also meet other requirements before you certify them. There are also state requirements, again, such as exams, licensing, background checks. There are federal regulations that you should also read over, and obtain a consumer's authorization prior to assisting them. We also have CMS-hosted webinars, and we have weekly newsletters that we send out every Tuesday. Listed on this slide are resources that I had mentioned earlier. Here is the online CAC application, the federal regs, the technical assistance, and this is a website that we keep lots of information on for CACs. There's also Find Local Help, that publicly accessible online tool that I went over, as well as a few others. Again, we have ongoing technical assistance. We have the weekly newsletter as well as the weekly assister call, and you can join those, or rather get emails for the newsletter and the assister call by getting on the listserv. The listserv is assister listserv, one word, at cms.hhs.gov. So we really look forward to receiving your applications. Social workers are a great asset and would be a great organization for CMS to designate as a CAC organization. So that concludes my presentation, and I'll turn it back over to Anastasia.
We'll transition over to our question and answer session. Stacy Collins, are you available to take questions?
Thank you, Anastasia. Hi, everyone. This is Stacy Collins again with NASW. Thank you to all of our presenters for your excellent comments. We're going to start by taking some of the questions that have come into the chat box. We have some very good questions. The first one I would like to give is to Pam Thompson. Pam, there's some interest in the type of tools that you are using in your hospital. Could you answer for us, first of all, what is a palm card?
which you indicated you handed to some of your patients, and also with your iPads, are the applications preloaded, or are you going through healthcare.gov or another or your state website to do the applications?
Yes. Can you hear me?
Yes, we can.
Oh, good. Yes, I'd be happy to. You guys, a palm card basically is a smaller version of a brochure. So it's just those little things that you can kind of put anywhere in a doctor's office or anything. They're just about a third of the size of a regular brochure, but they have all the information on them, and you can get like 3,000 printed up for like $60, $70, which is wonderful. And so we ended up actually having a picture done as well as all of our personal information to be able to give to our clients and for clients to pick up in various locations. So that's a palm card. As for our iPads, because we are state-based, we have our Your Health Idaho website that will be loaded on it, as well as internet access, and that is all you need. And they are actually working very well. We're having a little trouble right now with our state portal, but it's being remade, so it's looking really nice and very user-friendly. But we found with the iPads that we can go to a patient's room, we can sit in the hallway if we have to, anywhere we need to be, we can take those little iPads with us, and they're just a lot more user-friendly than a laptop. I hope I answered that question.
Excellent. Thank you so much, Pam. We have a number of questions that have come in regarding people who would like to become volunteers, CAC volunteers, but may not have the time to set up an organizational effort. Could our CMS representative describe any way that people could become a CAC volunteer, perhaps by going to a community-based organization and offering their services?
Sure. On Find Local Health, there's a search field where the individual interested in being a CAC volunteer can enter in their zip code, and a listing of assisters in their area will come up. They can then contact those assisters to see if they are available or if they're willing to accept volunteers in their organization. I think that's the best way to get started being a CAC volunteer in the closest area to them.
Excellent. Thank you so much. And is it possible for people to take the training without necessarily becoming a volunteer? People realize that this is an excellent introduction to insurance coverage in general. Is that a possibility, or is the online training, exclusively reserved for a CAC volunteer?
I can take the first stab at that, but I may need Tricia's assistance. The online training is specific for assisters, and so they need information in order to log on. As I had mentioned, that CAC ID that's created and assigned by the organization to their staff and volunteers is needed as the login ID. So I believe only assisters can use or rather access the training. Tricia, can you weigh in on that, please?
Yeah, I wouldn't have anything more to add about getting access to the training itself, but I would say that we have posted the actual training slides in PDF form that people can review and learn basically the same content that a CAC taking the training would learn. And so that information is actually posted on our website at marketplace.cms.gov. So anybody in the public can take that training or at least review that training material.
Excellent.
And we can share that link so that it can be shared with the attendees.
Great. And Pam and Tricia, a moment ago, there was a web address for people looking for CAC organizations in their communities that are accepting volunteers. Could you repeat that for everyone on the call?
Oh, sure. I'll have to go back to my slide, but it's Find Local Help. I believe even if you Google Find Local Help, you'll come up with the website. But again, I have to re-pull up my slides to get that exact address.
Okay.
So we can go on to another question, and as soon as I get it up, I'll share it with you.
Excellent, excellent. I would like to ask some of our social work speakers. I will start with you, Linda. Linda, are you on the call?
I am. Can you hear me?
Okay, very good. Can you tell us what, for your CAC volunteer students, what was the biggest challenge that they encountered in their work?
It's a lot of information to learn. It's a complicated system, and I think that has been it's a fairly steep learning curve. I think they were also perhaps surprised by how much time they needed to spend sort of debunking a lot of health insurance myths. People saying that they didn't want insurance, that they didn't want Medicaid when they might be eligible for some other subsidies, etc. I think they were surprised by how much education they needed to be doing with clients out there.
Great, great. Nikki, would you also like to answer that question?
Sure. I was just thinking through that. I think one of our biggest challenges was just what comes along with enrolling a new law, and at no fault of anyone's. It's just a massive change. And with that, you have policy that's coming out and policy that's being changed to reflect the needs of the people. But with that, there comes a lot of information that changes, and making sure that we got that information and then got it out to people across the state proved to be challenging at times. But that is just the nature of something so large, and that's okay. I think the other challenge is probably unique to states that didn't expand Medicaid. We have a lot of unique challenges in the state because of that, and also challenges with not having a Medicaid office to apply to directly. So we have to go to the marketplace, and the federal marketplace was not necessarily set up to do TennCare, our Tennessee Medicaid eligibility. So we have unique sets of issues with that, and others may experience that as well. But I would say the main thing was just making sure that we were competent at all times in an ever-changing landscape, which is to be expected.
Excellent, excellent. And before I go on, I just wanted to point everybody's attention to the chat box. Anastasia Pruitt just put the website for people who want to find a organization to volunteer at. That is localhelp.healthcare.gov. So we recommend that you look at that if you are interested in volunteering at an organization that uses CACs. And Pam Thompson, would you like to answer the question that I posed to the other two social work speakers about what was the greatest challenge that you and your volunteers faced?
Yes, I'd like to just concur with what Linda and Nikki both said, in that I take it for granted, having spent 35 years in healthcare, about how much I have learned, and it's still confusing. But it was a wonderful opportunity for MSW students to learn about health policy and the complications of health policy. And I would say that there is a lot of information to learn. That is the biggest challenge. Also, our state, we do have lots of gaps because it's a very rural state, and I found that the MSW interns, we have a lot of resources, but most of us have been in the field a long time, and they had not. And so, just trying to play catch up. But what a wonderful opportunity for any MSW intern to have! It was just fabulous.
Excellent. We might have time for one more question. Before we do, I'm going to ask that we put on the slides right now an email address for anyone on the call to send additional questions. This address is partnership@cms.hhs.gov. Please feel free to send questions to specific to CMS or to NASW, CSWE, or the Society for Healthcare Social Work. We can all have access to your question. One last question I would like, a technical one, I would like to ask to Pam and Tricia, if you could very briefly explain the difference between a federally facilitated marketplace and a state-based marketplace.
Sure, Tricia Beckman. I can take a stab, and Pamela Nicholson, feel free to chime in. Basically, from a consumer standpoint, there's really not a whole lot of differences. A lot of the eligibility standards are the same. You're going through a different website. The federally facilitated marketplaces use healthcare.gov, and the state-based marketplaces develop their own branded website, and they have their own single streamlined application. The big difference in terms of the CAC program is that it's run, in a state-based marketplace, run by the state-based marketplace. It's not run by CMS. In the federally facilitated marketplaces, CMS runs and kind of administers and sets the kind of guidance and standards for the CAC program in those states. And so hopefully that's kind of a general sense of how that works out. And of course, state-based marketplaces were given federal grants to set up their marketplaces. And so that's kind of the general overlay of that.
Excellent. I think that is going to conclude our call. I thank everyone who has listened today. I hope that you find an opportunity to be a CAC as an individual or as an organization that would like to sponsor a CAC program. And I'd like to thank all of our speakers today from CMS and from individual social work sites, our school, hospitals, and clinics. So thank you, everyone. Have a nice day.